In Italy, 7,000 doctors and nurses have been infected with the coronavirus and over 70 are dead. In Spain, 20% of the healthcare workers have the virus. In America, the toll amongst frontline medical teams is already frightening. Now, it's starting to happen here.
At Box Hill Hospital, 6 healthcare workers contracted the virus. Eastern Health still working to notify anyone who came into contact with them.
It's akin to getting soldiers and just bringing them out of the trenches without any armour, without any weapons, and just basically facing the onslaught that comes on. And this is an invisible monster.
In a major Australian hospital, this corridor leads to a ward where at least 20 COVID-19 patients are being treated. Every hand sanitizer dispenser is empty. And in this highly contagious environment, a cleaner can be seen not wearing head protection or an appropriate mask.
Right now, our healthcare staff are being infected, and in a week's time or so, they will be in intensive care themselves. And this is already...
Sydney anaesthetist Dr. Rob Hackett says one hospital has told him he could lose his job for speaking out. But he's voicing fears shared by many of his colleagues working in intensive care units across the country.
We're very scared. We can see what is happening across the world. We can see how we've been disempowered. We don't really have a voice. We want to be safe. We want to be safe when we're looking after people.
This is the sort of personal protection equipment worn by health workers overseas that doctors should be using here.
Their thick, waterproof suits means the doctors and nurses are sealed in.
But some Australian doctors are being forced to improvise, buying goggles, masks and shields from hardware stores. And in Dr. Hackett's case, ordering hooded gowns online because hospitals have simply run out.
Many of my colleagues who have purchased hooded gowns and other bits of equipment from Bunnings and have even pleaded for other people to go to Bunnings and buy these bits of equipment for them. I mean, we are desperate. You know, we're at risk now ourselves. None of us have ever signed up for this.
Several highly trained intensive care doctors have told us that they're simply terrified. And many say they are often faced with little choice to deal with suspected coronavirus patients without protective gear or face the sack. When Dr. Hackett brought his own protective gear to work, his hospital said he couldn't wear it.
The equipment we do have is pretty much nothing much more than a plastic flimsy gown at times. And we're having to reuse masks, and a lot of staff members don't have masks. And we're desperate to get these things onto the front line as soon as possible. This may not be the message that's coming from, you know, the managers and the governing bodies of healthcare, but this is certainly the message from frontline staff.
China manufactures the majority of personal protection equipment for health workers around the world. But when it realised this unrelenting virus was not going to be beaten, it took an extraordinary step. When this pandemic hit China, what happened to those factories you had there?
So we have 3 factories in China and a factory in Shanghai where the production was requisitioned by the government of China.
When you say requisition, that means taken control of?
Yeah, so the government sent people to take control of the inventory and the production in our factory.
The Chinese government commandeered Guillaume Laverdeux's company Medicon that produces millions of face masks and gowns and stopped him selling any overseas. Do you feel comfortable as the owner that you lost control ultimately of your own factories?
Not a comfortable situation to be in, but I'm not sure we have a lot of choices.
Shockingly, despite being in control of the bulk of the world's supplies, it wasn't enough. So China put a call out for more. And Australia responded.
I think the main concern was if all of these essential medical items leave the country, what's left for us?
In Sydney, staff at Chinese-backed company Poly Developments and Holdings were urgently mobilised by email to find masks anywhere they could.
If you have time, please drop by your local pharmacy to check if there are any 3MN95 or 8210 masks for sale.
Staff bought up what they could from pharmacies in Eastwood to Penrith, Hornsby to Mona Vale.
Meeting rooms, lunch rooms, and the boardroom starting to be filled with different types of items, getting unpackaged and repackaged and labelled. Definitely rose my suspicion.
This man worked at Greenland, a Chinese-owned property development company in Sydney. He saw tons of gloves, masks, gowns, sanitizer and other vital medical supplies being brought in, then shipped out of Australia.
The way this activity was organised, from going to procure different medical items, from the urgency to collect it, from the way it was unpackaged and repackaged, from the way full-time employees were utilised.
What our witness saw was being repeated in offices in companies around the world. Over the course of 2 months, China amassed an estimated 2.4 billion pieces of protective equipment, including more than 2 billion masks. By late January, with the coronavirus now a global threat, Australian doctors warned that our stocks of face masks were already dangerously low because of the bushfires. Federal Health Minister Greg Hunt didn't seem worried.
So there is a national medical stockpile of 12 million, in addition to those that were provided for bushfires, where there are still significant reserves with the states and territories.
But on February the 7th, the minister would learn that the World Health Organization was also concerned.
The world is facing severe disruption in the market for personal protective equipment. Global stocks of masks and respirators are now insufficient to meet the needs of WHO and our partners.
Despite that warning, and in full view of the media, on February the 24th, another Sydney-based Chinese company, Risland, sent 90 tonnes of medical protection equipment to China. It's a dilemma, isn't it? There are people in need somewhere else, but we find ourselves now desperately needing those same items.
But if you're operating in Australia, who are you listening to? Are you listening to the government of your own, of the country you operate in, or are you listening to your parent company in some other part of the world, and are you doing whatever they tell you to do?
Australia is now preparing for the worst of this pandemic, but frontline health workers are still desperate for personal protection equipment. Just last week, the Australian government finally banned the non-commercial export of PPE such as face masks, hand sanitizer, gloves and gowns. Well, now the government has banned the export of these items. What's your reaction to that?
I think it's good, but I feel like the horse has bolted. We could have been more proactive. We could have had some sort of contingency plans, in place, for situations like this.
No regrets for speaking up?
I think in a time of crisis, we all have a responsibility to do something. And I felt that I had to do something. It just didn't sit with me that this type of thing could happen. I couldn't just watch it and just stay silent.
Hello, I'm Tara Brown. Thanks for watching. To keep up with the latest from 60 Minutes Australia, make sure you subscribe to our channel. You can also download the 9Now app for full episodes and other exclusive 60 Minutes content.